Sore shoulders and knees, stress fractures, torn ligaments. Doctors at a local children's hospital are seeing a rise in student athletes getting hurt. Bob Jones shows us the way this pandemic is playing out is a big reason for those injuries.
13-year-old Camilla Green is passionate about softball.
So I've been playing since I was about 7 or 8.
And especially her position, catcher.
I love catching so much.
But when COVID-19 struck in the spring, it knocked her team out of the game.
COVID came out of nowhere, so we had to take a longer break than we expected.
Camilla barely tossed the ball around during that time, and when she did, about 3 months later, she got hurt.
The first time I threw the ball back, all I felt was pain right in my arm, and I had no clue what happened.
I definitely got scared because I was afraid. The biggest concern was if she would continue to overuse it to get that fracture, which would definitely put her down for even longer.
Camilla was diagnosed with inflammation around the shoulder known as Little League shoulder. Dr. Burke treated the teen and has seen a rise in the number of student athletes getting hurt. These x-rays show knee and shoulder injuries that put kids on the sidelines.
I've seen several stress fractures of the shin and foot, and I've also seen some acute injuries with football.
Dr. Burke says part of the reason for the uptick, athletes lost conditioning when spring sports were canceled. And over the summer, many have faced practice restrictions and on-again, off-again seasons due to COVID-19.
And when you lose muscle strength and then try to go back to the same sport, it's very difficult for those muscles to get back in shape very quickly like that.
Dr. Burke says it's critical for athletes who have faced delayed seasons to stay active because ramping up too quickly can lead to overuse injuries, even stress fractures. The doctor is concerned more injuries will mount in the fall, warning parents to be on the lookout.
If your child is limping, if your child is having pain as soon as they start practice or a game, that's definitely a warning sign that there's something else going on.
As for Camilla, she finished physical therapy and is ready to get back in the game.
A lot better. There's no pain at all when I throw the ball.
In Akron, Bob Jones, News 5.